Myself, Dr. Harpreet Kaur, MDMS, and I've done my diploma from Amity in IVF, and a practicing gynecologist also, and taking classes for 4-5 years. Now I am attaching with this telemedical council academy. Just that would be a course of 11 months that we will have classes every week and a 15 days offline class. So coming to the definition, the normal menstrual cycle is a tightly coordinated cycle of stimulatory and inhibitory effects that release of a single mature oocyte from a pool of hundreds of thousands of primordial oocytes. Follicle is different and oocyte is altogether different. So this HPO axis, hypothalamus, pituitary, and down the lane ovarian axis, that regulate all the menstrual cycle thing. And all the fertility, infertility, the female organ, everything is related by this neural structure. So this hypothalamus is small neural structure situated at the base of the brain. And it is above the optic chiasma and below the third ventricle. Hypothalamus has GnRH neurons, gonadotropin releasing hormone neurons. So ovary responds to FSH and LH in a defined sequential manner to produce. First is follicular growth, then is ovulation, and then is corpus luteal formation. See this graph. Day 1 of menstruation, we'll slowly see. First is FSH hormone, that orange line. That is starting in follicular phase. F for follicle stimulating hormone. So this will be seen in follicular phase, and this will stimulate the follicle. So it will stimulate follicle till ovulation. You can see the orange line, that is just before ovulation, it is at peak. And then after ovulation, it will go down. As follicle grow, follicle will secrete estradiol in the follicular phase. And once you can see very well the green line, the green graph, estradiol is matching with LH peak. Just before LH, there is a small peak of estradiol. So estradiol is high, then LH is high, and then there is ovulation. So estradiol is graph matching with FSH. Peak just before ovulation and then going down. In the early menstrual cycle, the ovary produces estrogen, whereas we know FSH equals estrogen equal early phase, which is responsible for the endometrial growth. Endometrial is growing in this phase. Following ovulation then produces progesterone, which transform it ideal form of implantation. If no pregnancy occur, ovary ceases to produce estrogen. Ovary ko estrogen, why it stopped? Because FSH is not there. So estrogen is back, going down, and obviously progesterone will also go down because there is no pregnancy, corpus luteum will shed off. There is a feedback by nature in our body, long feedback, short feedback, and ultra short feedback. Hypothalamus, so I was discussing, they are releasing hormone like GnRH, gonadotropin releasing hormone, corticotropin releasing hormone, thyroid stimulating releasing hormone, prolactin releasing hormone, growth hormone, ADH, and oxytocin. They all acting on pituitary. Pituitary is anterior pituitary and posterior pituitary. GnRH is unique among releasing hormone. It is very unique because it simultaneously regulates two hormones, FSH and LH. One unique thing. Second thing, it is secreted in pulsatile fashion to be effective. And this in continuous, if release, that I already discussed with you, it will down regulate LH and FSH. So this is the reason for using precocious puberty. Come to early follicular phase and late follicular phase. These are two phases. Follicular phase is divided in respect to infertility, early as well as late. So there are three opioids in the body: endorphins, enkephalin, and dysnorphin. The endogenous opioids appear to inhibit GnRH release within the hypothalamus, resulting in inhibition of gonadotropin secretion. So, clinical significance is endorphin levels vary significantly throughout the menstrual cycle with peak level in luteal and nadir during menses. So, the dysphoria experienced by some women in the premenstrual phase of cycle may be related to withdrawal of endogenous opioid. So, I just want to know what is the normal duration of menstrual cycle. Everybody must know minimum to maximum.
21 to 35 days.
Yes, very good. So 21 days is a normal day and 35 days also a normal day. Can anyone tell me? Some people came with very short cycles like 21 days, 22 days. Why? Does it indicate anything? Can anyone tell what are gonadotrophins? Gonadotropins are LH and FSH and they are going to act on gonads. What are gonads?
Ovary.
Yes, and
Testis.
yes, testis. So gonadotrophins are going to affect gonads, and then there will be release of hormone estrogen or progesterone that will leads to anterior pituitary feedbacks, positive or negative, and similarly to the hypothalamus. अगर हम continuous देते रहेंगे hypothalamus से pituitary में gonadotrophins, तो will it affect the cycle? What is the meaning of this pulsatile? What is the meaning of that continuous thing? Can anyone tell which phase is usually said to be constant among the three phases? That the duration or the time of this
Luteal
phase?
phase.
Yes, very good. These are more detailed about this follicular phase and everything. I think we'll take it in next class because that will be a 1 hour class now.